We're continuing the discussions at the Global Health Exhibition in Riyadh and getting a Saudi company's perspective on the health transformation program and the Vision 2030 of the Kingdom of Saudi Arabia. We're very kindly joined by Dr. Saeed Alamoudi, who is the CEO of Borg Diagnostics. Thank you very much for joining us. Dr. Saeed, let's start off by talking about such a great event that we have here and huge participation. Finally, post-pandemic is what we're looking at.
First of all, thank you very much for giving me this opportunity. Thank you for the introduction. I feel so good. We are back to normal after a long time, after the Corona crisis. We've been locked for some time, quite long time actually. And now we are okay. We are practicing our life. The exhibition actually very representative. And I think it's only the beginning. The event is very great actually because you see a collection of many brands here exhibiting their products and their services. Borg, one of these company exhibiting our services and our product. I can see the attendance is very high. I did not expect this much of people coming here to visit the exhibition, but I think the people miss this kind of exhibition after a long time of the crisis. Now people start to back to their normal life.
Right, Dr. Saeed, talking about the value-added services that you've got the home visits, the free consultation. Can you elaborate on that as well? How's that a huge showcase here at the exhibition in Saudi Arabia?
Now, having you asking this question, let me start by Vision 2030. Vision 2030, there are 8 pillars of Vision 2030. The first pillar and the most important one is healthcare transformation. And there are 3 pillars or sub-pillars for the healthcare transformation. Number 1, to facilitate the accessibility to the clinical services or healthcare services. This is number 1. Number 2 is to promote the prevention against the health risk factor. And number 3, improve the efficiency and quality of the healthcare services. The 3 pillars actually depend on digitalization. So the digitalization is the integral part of the Vision 2030. Now, in Borg, we are so much aligned with MOH hospital, non-MOH hospital, governmental like National Guard and Armed Force Hospital, private hospital, to improve the quality of and efficiency of the clinical services, which will help the end user, which is the patient. Now, Borg have started many solutions because of the pandemic of the Corona crisis. Now, during the lockdown, people cannot come to my lab, so we invited to go to them, home visits. And we have also free consultation. And we have adopted many initiatives like the mobile application going to be launched in a few days, improvement of the e-commerce digital platform, which enable us to provide a better, faster, smarter decision to improve the performance of business and manage risk. We increase our footprint. September last year, we were 42 branches. Now we are 72 branches, so we increase our existence, our geographic distribution. Borg now have 72 branches in the KSA, 27 in the rest of GCC country and North Africa like Ethiopia and Sudan. So geographic presence high to facilitate the accessibility. So we are working with the vision. We have also a very equipped call center to handle all the customer inquiry, working 24/7. And also we promote our training and R&D. R&D, now we have an R&D center, Research and Development Center, headed by Professor Saeed Alamoudi. He's from King Abdulaziz University and Jeddah University. And we have many scientific publications. We have also invented or developed a kit that can detect coronavirus in-house. So many things, many initiatives have been released by Borg during and after the crisis. And now we are waiting for the IPO very soon, IPO, initial public offering. We are going to be a public company, so that's also a very important initiative. Also, we have well-developed CRM software, customer relationship management, and this is very important. And also, we are going to operate very soon 2 mega lab. So all this initiative work with the Vision 2030 in order to facilitate the accessibility of the patient to the clinical services and to improve the quality and efficiency of the healthcare services, and also to promote the awareness of the population against the chronic disease and to take care of the general health of the society.
Lastly, I'd like to ask you, what's your expected outcome, and how do you see the future of healthcare of Saudi Arabia evolving through this exhibition and with the increased budgets that we've seen for year 2022, especially with about $30 billion was invested into healthcare?
See, and just I want to mention, first of all, that thanks Corona, there are some advantage out of the Corona. One of the most important advantage of the Corona, besides that we stayed with our family, we take care of our children, is speed up the achievement of 2030. We're expecting 2030 in 2030, but actually I see 2030 now. Digitalization, we work remotely, we use all the online tools to provide clinical services, to provide consultation, all this because of Corona. Lockdown, cannot interact with the people, so Corona speed up all the initiative of 2030. And I see the future of the healthcare very, very promising. It will. We are going to play rule number one, or we are going to be a number one player in the region, because there is collaborative work between the private sector and the government sector, which called PPP, private and public partnership, or private sector participation. Now, you cannot distinguish between the private and the government. They are working together, and this is a vision of 2030 to improve the service by collaboration between all the sectors. So, and I can see very, very promising future for the kingdom under the custody of the Crown Prince with the Vision 2030. Things are really, and I can feel it now, because I worked a while ago in the government sector for about 15 years, and now I'm working in the private sector. We used to, when we used to work in the government sector, we used to look at the private sector at high level. Now things are opposite. We look to the government sector. They start the initiative, they start the digitalization, they improve their services, and now that, stimulate us to work more in order to be in same level with the government sector and to be aligned, and eventually all this will serve the end user, which is the patient. Now, the patient, there are some initiative by 2030, and we are adopting our services according to the vision. It's to prevent the disease, not to treat the disease. Prevention better than cure. So population health, to take care of the health of the society by studying a group of people, see the chronic illness that they have, what are the causes of this chronic illness, the factor underlying the pathogenesis of this disease. So eliminate the risk factor, so there will be no disease. So people nowadays are spending in their wellness more than their illness. I don't want to get sick. So we are adopting this initiative, and this initiative also released by the government. So I think we are in the right track. Not I think, I'm sure we are in the right track, and we are part of this. And I wish the success for everybody, all the sectors, government, private, whatever.
Dr. Saeed, thank you very much for joining us and briefing us on the plans and what the Vision 2030 entails.
Sorry, can you say that again?
I was just saying thank you. So thank you very much.
Thank you very much. Thank you very much. Thank you. It was a pleasure for me to be with you. Thank you for your passion, and I hope that we added something to the people. Thank you.